Today we have posted a question or the case 7 here. A 59-year-old Hispanic male presents to ED with chest pain. Right? So he had the chest pain. ECG obtained which shows ST elevation or ST segment elevation on inferior leads. So it was a scenario of MI, right? Myocardial infarction. The patient got, thank God, treated immediately. But 48 hours later, what we are expecting or what are the complications we can expect, right? So the questionnaire, the motto of the question is to understand post-MI complication. MI is dangerous as well as post-MI complication is also what? Dangerous. In the sense that can even cause mortality. Patient can even die. So we have to understand the MI complications are divided according to the time schedule. In the sense we are average or probability, right? See, one of the most common post-MI complication, normally patient can die within 24 hours. In the cardiac ICU, within 24 hours they can die. The most important reason for that is ventricular arrhythmia. What is the reason? Arrhythmia in the ventricle. Because of either accumulation of what? Calcium, and they are causing increased what? Contraction. So if they ask us within 24, what is the most important reason? Ventricular arrhythmia. Then second one, they will ask us within 1 to 3 days, it means around 72 hours, what complication patient can have? We call it as fibrinous pericarditis. Fibrinous pericarditis. Very important. So, in 1 to 3 days, patient can die with what? Fibrinous pericarditis. What is the acute inflammatory marker? Acute neutrophil. So that will be a reaction from what side? They are neutrophil mediated. Fibrinous pericarditis what mediated? Neutrophil mediated pathophysiology behind it. Right? Remember, in 3 to 14 days, that is in by 2 weeks, right? In 3 to 14 days, patient can get the complications like free wall rupture or left ventricle pseudo aneurysm. Free wall rupture or left ventricle pseudo aneurysm can happen. See, more days. So what is the other mediator that can come there? Macrophage, right? They are what mediated? Either macrophage, or there is formation of what tissue there? Granulation tissue. Macrophage or granulation tissue. Then last one, if it is 2 weeks plus. 2 weeks plus. That is the most important or most common one people have chosen here. 2 weeks plus. We can have a syndrome called Dressler syndrome. Dressler. Or you can see the other option here. You can have mural thrombus. Dressler. That is after how many weeks? Commonly 2 weeks after. Actually, it is autoimmune. You will have joint pain, pneumonia-like symptom. Dressler. Or this is mainly because of scar formation. Actually, we don't know the reason for Dressler. It is classified as autoimmune. So, what is the motto of the question here? Post-MI time scenario. Within 24, what is it? Ventricular arrhythmia. Within 1 to 3 days, fibrinous pericarditis. Here it is calcium. Here it is what? Neutrophil mediated. 1 to 3 days is fibrinous pericarditis. 3 to 4 days, free wall rupture of left ventricle pseudo aneurysm. What kind of the reason? Pathophysiology, macrophage and granulation. If 2+ weeks, the patient is getting complaint, dyspnea, joint pain, or pericarditis. What is it? Dressler syndrome or mural thrombus. Either scar or you can say Dressler is because of what? Autoimmune. So what is given here? What hours is given? 48. So we are in about 1 to 3 days. So 1 to 3 days means we are expecting fibrinous pericarditis. Pseudo aneurysm happens in 3 to 14. Sorry, 3 to 14. Right? What about mural? 2 weeks plus. Free wall rupture 3 to 14. Dressler 2 weeks plus. What is the correct answer here? Fibrinous pericarditis. So lifetime post-MI complication. Thank you.